Hi YouTube, take two, apologies for the lack of makeup and the bad lighting, but the sun's going down, it's later than usual, it's a cloudy day, and my monitor is bright, so you just have to look at me with this weird, super shiny face. If I go back, you can see more of my face. If I go forward, I don't know, whatever. So, what I want to talk about today was something that I'm seeing in groups a lot. It's not bad or good, it's just a thing. And I follow this interesting mix on Instagram, so I see a lot of body positivity posts. A lot of the models I follow are, plus size models or curvier models. They're pinups. That's what I like. And a lot of the accounts I follow are plastic surgery accounts. And I've noticed a little bit of a schism in the groups, too. The groups of women that are going to American surgeons tend to be a lot more body-hating. However, for the most part, I wanted to address the idea that plastic surgery is a drastic measure and that, it's mutually exclusive. Either you're getting plastic surgery and you hate your body, or you accept your body as is and you have body positivity. And I can say from my experiences in these groups, that is not, it doesn't appear to be the case. I see a lot of dolls who feel like they're slaying now and who feel like they're going to be slaying after their surgeries. They're tweaking little things about their bodies. And some of this has to go, or has to do with, what happens to your body after you have babies. And that doesn't necessarily mean, it's not a value judgment on those changes. Some people like that their breasts are softer or larger or smaller or whatever the case is. Some people like me just don't really have them, and that's okay too. I like my body the way it is. I'm changing it because going back a little bit, I had to take one of this video, but my phone rang. It was some random number, and I just messed up the whole video. But I started out, before I was a professional content manager and writer, I did, I had a side blog that had to do with beauty. I used to be an esthetician and a makeup artist. Beauty, fashion, and retro rockabilly. That has always been my style. And in recent years, it was misconstrued by a lying tabloid as BDSM or something like that. But it's not. It was just fashion and beauty, because that's always been my favorite thing. And it's just always been an interest of mine. And again, I don't think that makes me vain. I just think, or I don't think that that's a less intellectual pursuit. It's who I am. Deal with it. But the point about that was, what was the point? The point was that the body that I have is absolutely fine. It works. It attracts men or women if you're into that. It does all the stuff I need it to do, but it doesn't really suit the styles of clothes I've always wanted to wear. A wiggle dress when you don't really have any boobs and not much of a waist and you're just kind of straight up and down. I mean, I do have a big butt. I always have. And, it's done me a lot of favors, but, wiggle dress is not really suited to my body type. It doesn't look bad, but it's just, there's nothing going on in it. So, things like that. That may seem like a shallow reason. It's just one of many reasons, but it may seem like a reason that doesn't, isn't worth it for you to get plastic surgery, but you're not getting plastic surgery. I am, and that's the way it goes for most people. They have their own reasons, and it's very hard for them to explain them to you or to anybody else, but that does not mean that they're not body positive, and that does not mean that they hate their bodies. Now, if you're in groups of dolls, I would kindly ask, don't ew at your own body or at anybody else's body. Don't post before pictures for people and who half of the people in the group are still not there to the point where they've gotten their surgery yet, and say ew and say gross, and because, these are people who are already considering plastic surgery. They may feel bad when they see you talk that way. Negative self-talk, negative talk about others' bodies. It doesn't serve any of us. We can change our bodies, we can change our breast shape, we can change our waist shape, we can change all these things, and it doesn't have to come from a place of hate. Just like when I change my shirt, doesn't mean I hate my shirt, and I know I've used that analogy before. And then I will pivot in this video because there's another issue I want to talk about that just comes up in groups a lot, and there's a big, and this is just for the Dominican dolls out there, so there is a big idea we've discussed in other videos about drugs in the Dominican Republic don't work. I don't know if that's true or not, honestly. I've never been to the Dominican Republic. This is going to be my first time. But a lot of talk has gone on about different ways. Some people get prescriptions from their doctors. Some people get prescriptions from their doctors for other procedures. Names on the prescription, that's great. Other people get drugs in other ways, borrowing or whatever. And, you know, I don't want to alarm anybody or distress anybody, but I don't know that that's necessarily a good idea, because as a person who is prescribed drugs that are more serious, they're not, you know, major drugs for anything major. I take Ritalin, okay? I always have, since I had my daughter. I've been taking it for 15 years, and it really helps me. It's same dose, it doesn't really matter, but the point is I know the rules about certain drugs, and you need to be able to produce a prescription with your name on it, written by a valid person, if asked. And it worries me a lot when I see dolls talking about bringing potentially papered medicine, or whatever you call it, just medicine that's not properly in their name across borders. You probably will be okay. I'm not encouraging anybody to do anything bad, but I'm just saying be aware of that. There are drugs in the Dominican Republic that you will be prescribed after your procedure. I don't know that it's worth doing that, so just be careful. I want all the dolls to be careful. I know that we're all just trying to have a safe, pain-free surgery experience, and I want everybody to get there safe. I want everybody to get home safe. You know, this is a very big, encompassing journey, and yeah, that, you know, it worries me. It's just something I wanted to get out there, because I'm not saying don't do anything, or don't do what you're planning on doing, or whatever the case is, not because of any specific post I've seen. I just see it a lot. I see the suggestion a lot, and it makes me nervous, because I want everybody to get through there and get to their surgeon and get to their surgery on time and not get into any trouble. And if some dolls could come forward who did not bring drugs with them, I am not bringing drugs with me. As a person who takes a drug like Ritalin, the chances of me getting prescribed something are extremely slim, but also, even if I were prescribed something, I don't know what my doctor is going to prescribe, and I don't want to mix medication, so I'm just going to go with what I get there. It has happened at least once a video. So, if anybody can shed some light on what the pain relief situation is in the Dominican Republic, all the other dolls would probably like it. I know there have been some scattered experiences shared, but, you know, it always helps to hear that you had a good experience or bad experience, or whatever the case is, so we can be armed with knowledge, obviously. Don't bring arms! So, yeah, I just wanted to talk largely about body positivity, because for the most part I see a lot of people defying the stereotype. You know, there's so many things I want to say, like, look, this is what everybody is like. This is not a community of insecure people who are just desperately trying to change their bodies. It's a group of people who think that they look fantastic, and they want to look more fantastic, and it's just such an awesome paradigm shift. But there you go. I just wanted to get that out there, you know, in case you were struggling with that, in case you were thinking, I want to get this tweaked or that tweaked, does that make me a bad person? Can I still be body positive and change this or change that? And yes, you can. You know, the key is in how you talk about your own body, and how you talk about other people's bodies, and how you talk about the changes to people's bodies and your body. So, use positive language. Watch what you say, not ordering you, I mean, just be careful with what you say. Think of the other dolls who are early in their journey, you know, who have been working to get there, who have a year to wait. You know, think about the fact that they're not there yet, and just be sensitive, you know, to that in the usage of ews and oh my god and disgusting and bad words. But for the most part, I don't see that, and good job, dolls. So, yeah, if you have anything to say about body positivity or pain relief experiences in the Dominican Republic, I probably should do another video soon about getting ready, but that's a whole other thing. I mean, I'm so bad at getting ready, even when it comes to just like going to Costco. I'm the worst. I'm like the literal worst. I'm horrifically terrible. I can't remember. I think I said in one group that I would probably forget my implants if I didn't check them. I'm bad with that. I have ADHD, that's why I take the Ritalin. But yeah, that's something that this weekend I really have to tie up and sort out, and it's a little bit intimidating because you know, this is the most involved journey I've ever taken on my own. And there are a lot of important things I need to remember to bring, and that includes getting my prescription filled slightly early, which is going to be very difficult to do. That includes making sure my funding is secured. That includes making sure that everybody in the house is taken care of before I leave. So I have a lot of things to do, as you, if you're a doll, right before your surgery, probably understand. So, you know, body positivity, pain relief, anything you have to say, leave it in the comments. You can tweet me at Kim LaCapria. I'll always be happy to talk to you. And, you know, I'm doing these videos largely because I didn't feel like there was, you know, I mean, there's Facebook, but there are very few places for dolls to connect with other dolls. So I just wanted to be a voice of, or a face, or, you know, that's a real person and she's really doing this type of thing for other people in my situation. So thank you for watching. You can subscribe if you want a lot more rambling videos in your feed, and, you know, comment, tweet, etc. Thank you.